Good afternoon, everyone. Welcome to the big webinar, a webinar produced by the George Washington University Milken Institute School of Public Health. I'm Melissa Goldstein. I'm a professor in the Department of Health Policy and Management here at GW, and my specialty is in bioethics and law. I'm really excited today to have two friends as panelists, actually, two amazing experts that we are so lucky to have join us today to talk about ethics in public health practice, which is incredibly important, honestly, to all of us who are interested in public health, who are interested in the broad reach of public health, and how much we have to do on an ongoing basis and how much that seems to increase as the days go by, which these two practitioners of public health will be able to explain to us very clearly. We have Dr. Lisa Lee, who has many titles at Virginia Tech University. Many titles, many expertise, right? Originally trained in public health. We also have Dr. Josh Sharfstein, who's currently at Johns Hopkins Bloomberg School of Public Health, but also has a very long line of prestigious endeavors behind his name as well. They're both going to talk to us at Public Health Practice for about 10-ish minutes each. And then we have a long list of questions from the audience that you guys thankfully put in beforehand, but we're also very happy if you have questions as we go. Please put them in the chat into the Q&A, and we will go through those and moderate. And thanks very much for coming. It looks like we have a growing right now. We're at 85 participants, so a really big audience, both US and international. I'm gonna stop talking now, and would one of you like to go first? Should I just randomly pick who's on my left? Okay.
It's
Dr.
no,
P.
I think we decided on this order. So thank you
Okay,
so
yes,
much,
please.
Professor Goldstein. Appreciate it so
Great.
much. And hello, Dr. Sharfstein. Really great to see you. As Melissa said, I'm a public health practitioner. My formal training, I have two sets of formal training. One is as an infectious disease epidemiologist. I did my training at Hopkins, and the other is as a public health ethicist. And so I spent most of my early career actually working in a couple local health or state health departments, and then spent the bulk of my career working at CDC in both the HIV division as well as working in the office of the director, doing a lot of this public health ethics work. So I'm going to just start with kind of the macro view, outlining ethics skills that public health professionals should possess in order to be effective in their real world work. And then Dr. Sharfstein will provide a couple of very specific examples that he has experienced in his own practice, as well as that he's helped others with. And then, as we mentioned, we'd like to really open this up to discussion and to address the questions, any examples or concerns that you have, having a bi-directional conversation here. So I'm going to start out by just getting us all to the same start line. Many of you know about public health ethics. Many of you have been in situations where you've been dealing with conflicting values or conflicting motivations and have had to work that out. So for those of you, please bear with. We just want to get everyone to the same start line so we all are using the same background to discuss today. So one of the questions somebody asked or posed earlier, one of the students, was what skills should public health students possess in public health ethics to be effective in the real world? And we all know that public health is a field of action. I mean, we do stuff. We have to get stuff done. And when we have to decide what to do, we have to consider a number of different inputs. In the diagram on the top here in my background, my background and my Zoom background, you'll see that any public health action really requires us to think of, obviously, to consider data and evidence as an input. We are an evidence-informed field, after all. We don't, just do things willy-nilly, but we're not entirely evidence alone is not enough. It's necessary, but insufficient. We also have to consider laws. There are many public health laws. These are things that tell us either things we must do as public health professionals, or inspect restaurants, or ensure that the public, has access to certain kinds of services like free or low cost vaccines, et cetera. And then we also have some public health laws that tell us what we're not permitted to do, things as public health professionals we can't do or shouldn't do. So data matters, laws matter, but so do two other things that I think get left out of the equation sometimes. And the third of those is values and ethics. So we have to consider the fact that people make decisions based on things other than just evidence and laws. They also make decisions about their health based on things they value. And we have to know what those things are, because we are making recommendations or policies for interventions for people other than ourselves. So we've got to move from this kind of individual moral compass, like what I think is best for myself, to more of what is our profession's moral compass? What does public health expect of us, and what does the community expect of public health? So what are our values? So we're moving from the individual to the collective, which is familiar to all of us, I'm sure. So as we make that move, we have to think about, well, whose values do we care about here? Well, we care about our own values, somewhat. We care a lot about our profession's values, and we have to care a lot about our affected community's values, because after all, we're making policies and implementing programs with them. And so we have to make sure that we understand what they value and how they're considering those values in their decisions about what to do with their health. Finally, a related concept is this idea of the fourth input into any public health decision is lived experience of affected communities. So we really have to think about, how do we account for circumstances of the folks and the communities who are affected by our work? So why do we care about that? Why do we have to worry about that? Well, we have to incorporate both community values as well as lived experience into our decisions, because again, when people decide about their health, they're using a lot more than just facts. They're also using what they value and what their own situation or context is, their social context, their economic context, et cetera. And this is, I think, one of the most important lessons we learned in COVID-19 pandemic, is that often we were very rushed to get in public health emergencies, this happens, but we get very rushed to do something. After all, we are a field of action, we do stuff. We were rushed to do something, and at some point we, I think, missed and not always, but in some situations we missed thinking about what is the lived experience of the people we're trying to affect, and recognizing that that's not a monolith, that different communities have different lived experiences and even different values in some situations. So in order to incorporate values and lived experience into our work, public health professionals need skills and ethics. That's these skills help us think about the should questions. What should we do? So we know evidence gives us a lot of information about what we can do. We want to be thinking about what we should do. And I really view this as kind of a 4-step process, that 4 sets of skills I think that every public health professional should have. And one of those is to identify the ethical dimensions of the work they're doing. So actually identifying, what should we do? Should we do A or B or C or D or some or none? And most importantly, why? What are we basing that decision on? We're basing it on facts and evidence, but we're also basing that on values and lived experience. So it's not always obvious what the answer to the should question is. If it was, we wouldn't be having this conversation. So But we do have to think about, these kinds of questions where values play a central role. And health is something we all value and all communities value. So it is something that, in which decisions in which values play a central role. So first thing is to identify the ethical dimensions. The second skill set, I think, is really to be able to articulate what values we've considered in our decision and where the value conflicts exist. So we all think about, public health as kind of the classic tension between what an individual wants to do, between individual autonomy and what's good for the community or community well-being. And that is a tension that exists, and it's a value tension in public health, but there are lots and lots of other ones because we value more than simply individual autonomy and community well-being. There are a whole bunch of other things we value. So there's lots of opportunities for conflict there. So after we identify and articulate the values, and to whom do we articulate those matters? We articulate those to the people we're working with, to the people who we're asking to do something. So we identify and articulate them, and then we have to decide what to do. So let's say we have a value conflict. We have to decide how to resolve that, how much to weigh one value over the other value, and then what that means for a decision going forward, really to get to an answer to the should question. And that requires that we choose an appropriate decision-making method. So there are a whole bunch of different ones we can use. Some are just administrative decisions. Somebody decides and we do it. Others are more complicated and involve a more comprehensive community deliberation. We maybe go out and ask people, what are you concerned about here? How should we move forward? What are the pluses and minuses of each of our options? And then when we're doing that, we're taking into account evidence, of course, the four things: evidence, the laws, the values, and the lived experience of folks. So we've identified, we've articulated what the values are, we've decided what to do, and then, like all good public health professionals, we have to implement it and evaluate it. So we might make a decision on one of these should questions to do A and C. Then we have to put that into play and make sure that there aren't, that we're aware of any unanticipated consequences, or we've adjusted to things that might have been challenging, and those kinds of things. So we're always in this kind of iterative process. And that's a critical piece of doing ethics, and it's a critical skill of all public health professionals. So the second point I wanted to make is just like somebody asked the question, who do we refer to when we have an ethical dilemma in public health? So who does this work? Who can do these things and who can help us do that? Well, in 2013, the Public Health Accreditation Board, or FAB, began requiring that all health departments who are going to be accredited have some process in place to identify and address ethics. So if you are working or do work at a health department that's accredited, you'll have some help there because there's some process in place that they had to do and put into place in order to get accredited. So there are people there who can help with this. If you work, for example, at CDC, they have a public health ethics committee for the whole agency that can serve as a resource. So that's an option, but most of us won't work in one of those two places, and we'll have to think about where to find guidance for this. And there are a few places that I would highly recommend that you and your colleagues can go for public health ethics expertise. And one is the American Public Health Association's Public Health Code of Ethics, which was written by several of us in the public health ethics section, or in the ethics section of APHA. So there's a whole set of resources around that. There are also a couple of other professional organizations that have public health or health ethics affinity groups, including the American Society for Bioethics and Humanities, or ASBH. They have a public health ethics affinity group, as does the Association for Practical and Professional Ethics, or APPE. So there are a few pockets of resources around for folks when you find yourself in a situation where you're really struggling with some should questions. And make sure, I want to make sure that folks around this table and elsewhere in the system of public health are aware of these resources, so we can do what we have to do to rebuild the trust that we need in our work in order to be effective. So I'll stop there. I'm going to let Dr. Sharfstein talk a little bit more about putting this into specific action, those very practical kinds of cases he's seen. Thanks.
Great, and we'll turn it over to you, Dr. Sharfstein.
Great, thanks so much. And thanks for having me. And what a great introduction from Dr. Lee. I'm Josh Sharfstein, actually sitting in the Baltimore City Health Department today. Part of my job at Johns Hopkins is to these days is to spend a little bit of time there, which is always great for me and reminds me of my time here as the health commissioner. So I'm going to talk about two categories. One maybe is this issue that Dr. Lee introduced. You have an ethical dilemma. How do you sort your way through it? So I'll give you a specific example. And then I'm going to talk about something that came up a lot in the questions that were sent to us about like the ethics of actually doing the job in public health and what happens when there are conflicting pressures when you're trying to do the right thing. So it's a little bit of a different kind of ethical question. So for the first one, the example I'm going to give is a project that was intended to reduce falls among older adults. And the idea here is that a lot of falls are preventable. And falls are terrible. It's I think the leading cause of injury death for older adults. And it's often the one that knocks them out of being able to live independently and puts them on a pretty seriously negative course for health. So preventing falls is like all the difference between, living the life you want to live at home and being, really struggling to get back to a baseline that may never come back. And so you're a health department, you want to prevent falls. And in Baltimore, in Maryland, there is a health information exchange that tracks data for different conditions, primarily so that clinicians can look up patients when they come into the hospital, but it also collects the data and in theory could be used to identify who is falling and even map the residences, at least, to people who are falling, and potentially reach out to people who are falling to offer them services. So it's the idea, at least the concept, let's just start with the concept, is that you could take data from the healthcare system and identify areas of the city where people are falling and maybe put prevention programs in there to prevent other people from falling, but also possibly reach out to people who fell because the risk of a more serious fall is one of the biggest risks is having already fallen. So if you've fallen once, what can you do to right there help the individual person? So there you can see the idea behind, it's a noble idea. But in order to do this well, you can't really do it with consenting each individual person for their healthcare data to go over to public health. You'd have to be able to get the data from the healthcare system without individualized consent. And public health departments are able to do that under the law through a provision that exists in the HIPAA law. In order to do that under the law, like Dr. Lee said, you have to have a good plan, you have to have a rationale, there has to be a legitimate public health purpose. And from a legal perspective, that may be enough to have, you've got a good plan, we've got noble goals. But at the same time, let's just say, and maybe I should have started here, that public health legitimacy is really based on trust and understanding. And, public health history has a lot of unfortunate problems with ethical violations. And so you want to go the extra mile here. You don't want just to say that, well, I think it's legitimate public health purpose. I'm legally entitled to the data. I want to, or at least I'm not entitled, but a legal access to the data. I want to really do this in the most ethical way. I want to engage with the community, make sure they're comfortable with the plan, and get their input on how to design it. So what the health department did at that time was, in order to get the data, they had to go to the Health Information Exchange and present it to a committee that provides access for specific purposes for public health. And before doing that, though, they decided to go and make a public draft of their plan so that people could comment on it. And that way they could hear if there's any concerns, because you could imagine people saying, I don't want, the government tracking who's falling and trying to help that community. It just feels, I understand maybe they have good intentions, but like I didn't give my permission for the fact that I fell to go somewhere. And I certainly don't want people showing up on my door offering me services just because they heard I went to the emergency room. So that you could imagine someone saying that. And so we wanted to get public comment, but doing public comment from posting it on the website and sending out press releases and calling people, I mean, that's good. But of course, the people that you are really trying to help, who are most involved, are the people who are potentially at risk for falling, and they may not be your most nimble internet users to do comments on a draft regulation, or a draft proposal. And so what the health department did is convene focus groups. They went to senior housing, they got people to volunteer who were interested in talking it over. And I went to one of those, and it was very clear, talking to people, that they were really worried about falling. Like, they were terrified of falling. They knew people who had fallen and, could never live the way they wanted to live again. And they said, look, if there's something that can be done to prevent me from falling and losing my independence, please, thank you for asking me. I absolutely think that would be great. What kinds of services could be available? So their emphasis was very much on their independence. It was not so much that they distrusted the health department to do the right thing with the data. And that gave the health department confidence to move forward. And I remember one of the early findings when they looked and mapped where some of the falls were, was that a grocery store had moved, and it was really hard for people to get from a senior housing to the grocery store, and people were falling, and some different plans were put into place to address that. But that is an example, I think, of tension between different values, like Dr. Lee said, but also listening to the community, giving a chance for people to have input, and beginning to start a program intended to improve health in a way that I think I might have managed to mute myself, but now I'm unmuted. So that was my example of something that is how you implement these. You think through a program from an ethical perspective. But there were a lot of questions about, well, what if you're in a job and you have an ethical dilemma? And let me take two dimensions of that really quickly. One of which is, what happens if you think you know the right thing to do and your boss doesn't want you to do it? And let's face it, in COVID, that happened from time to time in this country. And so, you think you've done all the right steps. You really believe something is the right thing to do, but it just can't be done. How do you process that? And I think of that in a couple different dimensions. I think there's certain things that are just wrong to do under any circumstances. So it's like being forced to do something that's wrong, I think is hard. And for many people, I would say the right thing to do is to refuse in that setting. If it's, but then there are other situations where you want to do the right thing and people won't let you do the right thing. And that's a little bit different. And you have to decide how important it is in the moment. When you're in public health, you're not elected the king or queen of the world. You don't get to decide everything. You're not omnipotent. We're in a society with a lot of different political interests. And so you have to decide what is so important to you that you really need to say, well, this is it. Either I get to do it or I can't do my job. And that's a tough position. In my experience, it's really hard to know where that line is until you're facing it. I'll give you an example. Back a long time ago, there was a noise ordinance that we enforced at the health department. And there were some protesters who were violating the noise ordinance, and a law firm was complaining to us, and we were giving citations to the protesters. And someone in City Hall called me and said, look, the protesters are allies to the mayor. You have to stop giving them citations. Now they were violating, their complaints were coming in, and we were sending out inspectors who were providing the citations. So what do? And I said something like, well, it'd be kind of self-defeating to not give the citations because then, you know, this is over 15 years ago, then the inspectors might realize that they're being, you know, they'll realize they're being told not to enforce the law, and they could go to reporters or complain to people, and it would just blow up in everyone's face. So I don't know if that's such a good idea. And the person I was talking to in City Hall, who was not the mayor, said to me something to the effect of, "I'm sorry, do you not understand English? You know, I'm telling you not to do any enforcement here. That's what I'm telling you to do." And so it's like, you know, kind of tough position to be in. And I had a chance for one more question, which was if I'm able to talk to the protesters who support the mayor and work something out with them, is that going to be okay? And I wound up, and he said, well, okay, that would be okay. So I drove over to meet with them, talk to them about what was going on, explain the noise ordinance. They didn't really understand why they were getting the tickets. And we essentially worked out how ways that they could protest that would be within the noise ordinance, and they appreciated me just showing up there. So like I was able to thread the needle between what City Hall wanted and the fact that my inspectors, you know, wanted to do their job, that was hard. And there have been, you know, other instances where it's tough, and there's probably a moment in public health where you have to say, you know, here I stand, I can do no other. But it's not everything, you know, and when I worked in every job that I've had, there are things that I might recommend that somebody is going to say, you know, I don't think we're ready for that. Here's a consideration. And I have to respect that. I'm not the person who got elected. A lot of them are political judgments, but there are nonetheless, I think, moments where there may be something that's so important to you that it really matters. So I think that there's no easy answer there. I'm not trying to give an easy answer, but I think you have to recognize that that area of ethical challenges exists. And related to that is, I think the last thing I'll just mention is the challenge of when to apologize for something, because ethically that may be the right thing to do. If your department, if you yourself made a mistake, and there were consequences and people are upset. You know, in medicine, there's a lot of literature about this. Like apologizing is an important part of the healing for people and to understand, but also it maintains your credibility practically. If you want people to still believe you and you say, well, like we did make a mistake here, you know, and I think that that's important in the right settings. If you, in fact, you made a mistake. The challenge is that almost everything in today's world points against doing that. So, you know, social media, people being nasty, they can make a much bigger deal of it or turn you into a horrible person, even for admitting something. You have your own staff who often feel very sensitive about it and don't want you to do that because it might reflect poorly on them. There could be lawyers around who are afraid of liability. There are the politics. People don't, you know, for political reasons, it could make your boss look bad if you apologize. Very stressful. Some of the biggest stresses that I've had are over this situation where I want to say, like, look, we could have done better here, you know, and yet there's so much pushback against that, and it becomes ethical, I think, for me in my experience, because I think it's important in order to be honest and feel like you're doing your job as well as possible. Just like if you were a surgeon and, you know, made a mistake in the operating room, to say, look, yeah, I made a mistake. Here's how I tried to fix it. Here's what we can do for you. You know, this sometimes happens. To be like that in public health too, it can be very challenging, particularly when the, you know, political scrutiny is really high. And in my career, I've generally found that all the worst case predictions from apologizing do not come true, that people actually are so shocked that someone apologizes in, you know, the modern era, that they actually appreciate that you're being honest. And it has allowed me in very difficult circumstances to maintain my credibility so that I could actually solve the problems that, in some cases, we had a contribution to the problems, but we were able to stick with it and solve the problems. And I think that is a different kind of ethics. So anyway, I'll stop there, Melissa, and maybe look forward to the questions.
Wonderful. Thank you both so much, Lisa, for structuring the discussion for us and giving us an idea of what public health ethics are. And Josh, for giving us concrete examples. We really, it's very helpful to have ideas to think about. In fact, we already have 2 questions and we'd like to invite more. I am going to start with Mama Doo's question here in the Q&A, and I'll read it. I don't know whether you guys can see it. It's probably a question for both of you. And what they ask is, I would like to know if it's possible to separate public health from ethics, because it seems to me that it's difficult to associate the two, especially in our African countries, which I think is a great context for us to set about the nature of public health ethics in a global world. Like, perhaps this question is focusing on what is the difference between clinical ethics and public health. Is public health ethics more of a maybe a new idea in public health, focusing on ethics alone? Certainly from an academic perspective. Lisa, do you want to give your perspectives first, and then we'll go back to Josh?
Sure. Thank you for the question. It's an excellent one. And I do think that one of the things I've learned over now my 3 decades of doing public health ethics and ethics in general, bioethics as well, is that context depends, context influences things a lot. And so it's not necessarily that people's views of what should be done or what's right or wrong, which is often what we think about when we think about ethics. It's not that that's very, different. There are, 5 or so things that, people across the world, across cultures really believe to be true and that kind of thing. We shouldn't hurt people, these kinds of things. But context matters. And the context of public health is very different than the context of clinical health or health care. And that's why the approaches to how we prioritize which values actually make a difference. Because in healthcare, for example, we're very interested in what's right for that patient sitting right across from us. That's very different than what we think about in public health. Is our patient is not an individual person who has strong feelings about something. Our patient is our entire community, or in some cases, a whole population. And so we have to deal with a lot more conflicting views when we deal with a community than we do when we deal with an individual. So compromise becomes really important, and how communities compromise is very context dependent. So if you live in a very communitarian kind of community or village or state or population, you'll approach compromise very differently than, say, if you live in a very individualistic kind of society where every person feels very sure about their right to do whatever they want. That's a very different kind of compromise. So this idea of separating public health from ethics, I don't think that is possible, nor do I think we should strive for that. I think what we need really to do is incorporate ethics into public health. And we actually all do that already. So it's important just to be able to identify how we do that and where we do that. So that would be my first kind of initial response to this type of question.
Thank you. Dr. Sharfstein?
That's a great answer. I would just maybe add this, that good intentions are not enough. In public health, we have good intentions to improve health. But public health can be pursued in ways that are ethical, in ways that are unethical, and in ways that are questionably ethical, and, this could be a lecture on history, and everybody's, everybody's blood pressure will go up hearing about the history of ethical violations of public health. And so it's really important to have that kind of humility going into these kinds of things. And I think even if you're from the very community you're working in public health, there can be things that are ethical or unethical, especially if you're not from the community. Things can be unethical that are pursued. And I think, the beginning place here is to be humble in the face of that, recognize that there have been all kinds of violations in the name of public health, and then really do your best to follow the different processes and approaches that are laid out in order to do a good job. So whether but it may look different in different places, But it's extremely important to do that. And I do think that there's a lot more attention being paid to this. There's a lot more attention being paid to the ethics of global health, the ethics of international organizations working in low-income countries, and whose agenda it is and how they're listening. And this happens not just at the level of an individual program within a country, but literally an entire development program needs to be looked at from an ethics lens as well. And so there's a lot more to be said in this area, but I think the beginning point is just recognizing that at every level, ethics has to be part of your consideration.
Thank you both. I think this is a great segue into the next question, actually, from McCall. How do you balance not wanting to upset people, but also stand up for your ethics in both research and policy in terms of public health? And I think you both spoke to this a little bit already, but this person might have specific things in mind.
Well, I actually really love this question because it gets to the root of what when I teach public health ethics in our program, which I teach MPH students this each year, most of them come in saying exactly something like this. What do I do about when I think something's not right, or when I think? And so Dr. Sharfstein talked a little bit about that. Like we as professionals also are human and we have our own moral compass. One of the most important things we can think about as public health professionals, which is related to humility, is that it's not about our own personal moral compass. We are really needing to ensure that we are clear on what our profession's moral compass is, what we value, what is our moral guidance as a profession. And how do we know what that is? Well, we in the American Public Health Association and other countries have done their own work on this, but have come up with a pretty good set of things we value. And so we should all be very familiar with that. If you haven't already looked at either your country's or the American Public Health Association's Public Health Code of Ethics, I highly recommend it. It'll give you an orientation to what the profession values and what we want to, as a profession, want to tell the people that we serve and that we work with. This is how you can count on us. This is what we value, and this is what you can expect of us. So if you have a personal kind of moral stance that is in conflict with your professional moral stance, that's something obviously everybody has to work out. And some people work that out and are able to set their own aside, others not, and they pick a different profession. But I think it's really important to understand that part of doing ethics is not just knowing what your ethics are, your profession's ethics are, it's also the ability to explain that to other people. So a big part of ethics is communicating why we are making decisions to do things. The example Dr. Sharfstein gave about the falls and keeping track of that and having data moved around. The why is really important. People want to understand why you're trying to do what you're doing. And that, if you can speak to that in terms of why, because the evidence tells us something, because it aligns with the laws, because because of these values, because we care about you, because we want to prevent illness and injury, and that we understand your lived experience. This being able to articulate the why can really help take that edge off of people being upset because they understand why you're making decisions.
Yeah, I would say that's certainly true when, we're talking about public health challenges and the ethical issues involved in them. Sometimes, like when the person in City Hall said to me, "Do you not understand English? I'm telling you what to do." It's a different kind of discussion. They're not interested in the why. It's like it's directly an issue. And so I've been in, all kinds of situations like that and had to speak up. Sometimes it's not so much a feeling that like my ethics reverse to public health ethics. It's more like my ethics are completely consistent with public health ethics, and there's something else knocking at the door, and I have to decide how to handle that. Among other tactics there, I think it's really important. Personally, it's helped me a lot. I wouldn't presume to say what it is for everyone else, to try to be as nice and friendly interpersonally as possible. Like, I don't need to add to the sting. If I'm going to take a strong position on something, I will let the position speak for itself. But personally, I try to make it feel like it's not personal. It's just something that I feel strongly about. At times I've said things like, look, I will resign over this. I won't mention why I'm resigning. I will, I just can't do it, that way. And I will get out of your way. And I'm very nice about it. Maybe some might say even too nice about it, but I make it very clear that I think it's wrong, and that's why. And that's just really important to me. And, so to me, like, that's one way to make the balance a little easier. I'm not trying to throw on the scale a lot of like, you're a horrible person for doing this or whatever. I kind of make it more like, look, for these reasons, I don't feel that this is right. I'm prepared to step down, and so that I'm not involved in it because I think it's wrong. And, those situations have actually worked out. And I think it's in part because I'm trying to signal that I still respect them. It's not personal. I'm not turning it into like a really nasty situation, but I'm trying to focus on the issue that I think is most important.
I'd like to follow up on those ideas a little bit. Like you both have mentioned to a certain degree the personal cost that some of these decisions actually take on public health professionals. Lisa, the idea of moral dilemmas, moral issues within ourselves and the toll that that takes over, a lifetime of work and dedication and a mission of what we're doing. And Josh, you've mentioned, career, right? Actual career, like resigning or what this means in terms of actually pursuing your own goals or your family's, comfort or what happens in your own career. Like, how do we balance those issues in a world where the ethical answer is not always clearly the one that's going to win out?
Let me just jump in and say it's not that easy, and my experience is it's really hard. You can think about it, and then when you're presented with the situation, it's really hard to know what to do. There's a very interesting article in the New Yorker that has made me think about ethics a lot, about this horrible situation with the princesses in Saudi Arabia. And there's a doctor who's come forward and said that for like years, he knew he was unethically prescribing sedatives so that they could be sedated against their will. I'm just giving a quick summary. And with the hope that he sort of justified to himself that even though he knew it was wrong, if he left, someone would do it without moral compunction about it, I guess, and that maybe he could use his relationship to eventually get them to freedom. Again, I'm sort of reading into the article a little bit, but what is described is a gross violation of medical ethics. Just a total violation of medical ethics, and someone who convinced himself that maybe it was a good idea for the right thing, down the road. And, I think that it's on the one hand good that he knew what was right and what was wrong, but he really was unable to follow it. And I know that, in a way, he sort of is coming forward now, I think after at least one of the princesses has died, if I recall in the letter, in part because of guilt that he didn't do the right thing at the time. But it's hard to read that article and think that he did the right thing at the time, because I think it's really a devastatingly horrible situation as it's described in the article. And so, these are real things. Public health is incredibly important to society. And these issues are really important, and the ethics of public health are really important. And it's part of like the medical profession. You go into public health, you're really signing up to do public health the right way. And so figuring out, how to do that, how to express that, there can be personal costs at times, and that should be something that I think people take into account when they choose public health as a career.
Yeah, I think those are excellent points. I think this idea of moral distress, which is something that really is there's a full literature on this in the nursing, in the nursing profession. And I think one of the things that COVID really shed light on was the moral distress among public health workers. So moral distress is this idea when you are sure of the right thing to do, but you're unable to do it. And whether that's because of your own personal convictions that you think it's right, or it's because of the profession's convictions that it's right. But this idea that you can't do it, and that distress within each of us can be quite debilitating. I mean, and there's a full literature, as I said, on this with nurses, but a lot of that has been now adapted and looked at through a public health professional lens or public health profession lens. And that literature is really helpful, I think, to a lot of people. It is not an easy thing. It's very challenging for anyone to do something against kind of what they believe is right or what they believe is wrong. I do think in public health, often the ethical questions we're dealing with are not crystal. It's not about, is this right? The answer is yes or no. Or is this right or is this wrong? Usually what happens with the kinds of things that we deal with in practice are there are many different approaches we could take, each with their own positives and negatives or benefits and risks. And what we have to do is look at what those are, take a minute to reflect on that, and think about what is the best thing, all things considered. So that means if we're in a pandemic or an epidemic, that's something to consider. We might make a decision during a pandemic. That's not the same decision we would make during when some kind of condition is endemic, for example. So, I do want to make sure that folks understand that it isn't always about some absolute right and absolute wrong, and you're just teetering on that line. Most of the time, the hard questions are those things that there are several right things to do, and we really need to evaluate and pick which one. Or there are some things that feel more wrong than others, and we have to do something, but we have to pick among like the least of the evils kind of thing. So I do think that it's important that we recognize that we are one of our reactions as a public health professional to thinking about ethics and doing ethics is that we will have moral distress, and we should help ourselves understand ways to give ourselves resources and ways to cope with that, whether that's working with, somebody who works with moral distress, a counselor, a therapist, or something like that, or even just a community of practice of our colleagues who can say, yeah, this is what I did in that situation, or here's how I coped with that. That can be, normalizing that a little bit can be really helpful for our staying power in public health, for our not leaving the profession.
I think those are great ideas. And also helping prepare our students for the fact that it is not always going to be simple and easy and like math, although math is not simple and easy either, but like there is no formula necessarily, and people will not necessarily agree with you.
Yeah, and I talk to a lot of my former students who go, are in public health, and they'll call me and say, what do you think of this situation? What should I do? And we talk about it and try to problem solve, the situation. And, would it be helpful to do a public comment? Is there an established group that you can get input from? How do you work through this? I totally agree with Dr. Lee that a lot of these situations are not, cut and dried. And so finding room to explore and find a good landing spot and figuring out how to get the space to do that is a bit of a art, and so we talked that over.
Yeah,
That's
I think
great.
if there's one message for folks on this call, or to any of your colleagues on this call, it is that ethics is not something you do by yourself. It's not about you making a decision. It's really about how do we bring to light the values we're considering, the conflicts that exist, and do it with our colleagues and with the people we're working with and serving, the communities we're serving. I mean, if the example of the falls and collecting the data on people who fell, somebody sitting in a public health department could have just made the ethical decision and said, this is what we should do. But we don't for the very sensitive ones, or the ones that are complex, we don't do that. We actually work with each other. And that's something I just want folks to know, is that if you're feeling moral distress, or you're feeling like you're not sure you want to do something, or that this is the right thing to do, it is really important to talk about it with trusted colleagues and perhaps your supervisor or other people. So don't dive into this thinking, oh my gosh, now you have to learn all about ethics so you can pick the right thing. That it's about a thing we do together. It's about how we live together, how decisions we make to live and work and be together. So we should make those together.
Very good advice for us all to remember from both of you. I think we should end now with a little bit of a fun one and frightening. Anonymous has asked for you to comment on, in what ways do you think artificial intelligence will change the way we practice public health from an ethical perspective?
I'll jump in and say I think artificial intelligence is a full employment program for ethicists. There are lots of ethical questions that are being raised by artificial intelligence. And in fact, the technology and business side of this is racing down the track, and the ethicists are getting their shoes on, but they will be needed desperately because there are many, many serious ethical issues being raised by artificial intelligence. So it's among them, like, where in the world is this data coming from? Is it being used appropriately? Whether it's systematically biased, whether who's profiting from it? There are so many ethical questions that are just coming up. So I think it's a pretty wide open field right now, because AI is a wide open field and just getting started to a large extent. But I do think that there's some very, very serious ethical issues coming. Happy to go into specifics, but I want to hear what Dr. Lee says too.
Yeah, no, I second that. What you said. I will also say that it's, like any new technology, there are ethical dimensions associated with implementing a new technology. And some of the questions we ask ourselves is, does this technology do what it says it does? So is it valid? Does it produce the results we expect it to or that we think it should? Another is the crucial one in public health, of course, because our focus is so much on social justice, is this new technology fair and just? And we already know from a plethora of evidence that the way we train algorithms, the way we train generative AI is based on humans, and humans and what we've produced is not fair. We have biases. So to make it better than humans, we have a lot of work to do. And as I think Dr. Sharfstein said, we've got, lots of employment opportunities for public health ethicists in this arena. It's going to be critically important that we look carefully at the potential harms that this new technology might inflict on, and on whom. We're especially sensitive when that happens. Those harms are exaggerated and more harmful among folks who have traditionally been underserved by public health, or who have otherwise been minoritized or socially, who have less social capital. So there are, lots and lots of questions about AI. On the plus side, I would say that there are probably some things that AI could do that would help alleviate some of the drudgery of public health work, that might then free us up to have a little bit more time to reflect and think about ethics, or reflect and think about new ways to do things. So I think, like with most things, there are pluses and there are minuses. The important thing for us in public health is to be aware of what those are and judicious in our decisions to implement things that might cause more harm than good.
Thanks so much to you both. And in general, we are so lucky to be able to talk with you a little bit today. Like I said before we started, I wish you were both here in person so that we could just have this chat for another couple of hours, and I could see you both in person. It's been wonderful for our community to get to hear from you both a little bit, well, in person, as opposed to reading all of the material you put out that, of course, we all use in our classes, right? And thank you for being prolific that way. I think we have some closing slides, but I do want to let you know that we do have all of your questions and we will follow up on them. So don't worry that we're not going to. We'll send them to the panelists to see if they have any comments that they want to share. Some particular ones about changing undergraduate public health education, changing medical education, things like this. I want to give a brief update on what we're doing next. So we do have a webinar coming up in November. We try to do one every month. This one is focused on ethics and sexual reproductive health with Rebecca Cook, who is at the University of Toronto, and Mary Ellsberg and Julia Strasser, who are both here at GW, and that'll be on November 20th at the same time, 12 to 1 Eastern Standard Time in the US. And I think that might be all. Thank you for coming today. Some additional resources here. We have the recordings of all of our webinars, which we started during the pandemic, actually, here at this website under additional resources. And then for those of you who are GW School of Public Health students who are seeking professional enhancement credit, please email the form to gwsphbig@gwu.edu. And one final thank you to Dr. Lee and Dr. Sharfstein, expressing my personal thanks, but really how lucky it was for us to get you both together on one day. Thanks again. It's great to see you, and I hope to see you again.